How can I get rid of my under eye bags? Is there a permanent solution? I am male, 18 years old. I've had these under eye bags for the past 1 year. I'm really losing my self-confidence because of this. Please help me with a permanent solution to this. Thank you.
Thank you for your question. You're 18 years old and you submitted a single photo demonstrating under eye bags. And you stated in your question that you've had these eye bags for about a year and that it's affecting your confidence. Well, I can certainly share with you my approach to evaluating patients like yourself who come to my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and under eye bags is one of the most popular things that we deal with in our practice. In fact, half our patients for under eye bags are men, and it is really remarkable how under eye bags transcend who's affected, whether it's age, gender, ethnicity. So certainly I have a lot of experience and I can guide you as to how I would approach a long-term permanent solution for someone like yourself. To begin with, let's understand a little bit about what has happened and why it's happened. Well, what has happened is basically the prolapse or pushing forward of fat that's normally around the eyes. When that happens, we refer to it as lower eyelid fat herniation. It means that the under eye bags are the result of fat pockets that have pushed forward. Now, the cause of this, when we look at someone who's young, is generally genetics. Now, it doesn't mean that either of your parents definitely has them, but it's something that runs in families. In fact, in my practice, I've actually operated in the same family 3 generations of people who have under eye bags. It's very, very common. And being in practice over 20 years, I've had the opportunity to certainly help people in terms of their siblings or their children or their parents because of this familial trait. Now, the definitive procedure that I would offer someone like yourself in our practice as something that is a long-term solution would typically be something called a lower eyelid transconjunctival blepharoplasty. What this is a procedure, procedure we perform in our office under local anesthetic, where I approach the fat pockets from behind the eyelid. This way we are able to avoid any external or outside incisions, able to address the fat pockets by reducing and sculpting the fat as is appropriate, repositioning as is appropriate, and ultimately improving the appearance of the eyes by taking away the under eye bags. Generally, what we do is we'll do this procedure also with a little bit of intravenous sedation, which means that you are not under general anesthesia, but rather you get an intravenous and then given a little medication to help you relax. Procedure is generally done in less than an hour, about an hour, give or take, and you're able to go home the same day. Our facilities are certified by the Joint Commission, so essentially what we've done is created a situation where the safety and the staff are on par with what you would receive at a top hospital, but in the comfort of a private office setting. The point of that is because people are very often hesitant about pursuing surgical procedures because of what they perceive as very intimidating circumstances, such as going into a hospital or a surgery center and being one of a lot of people waiting to have surgical procedures. In our practice, we actually have bypassed that and allowed our patients to actually comfortably have these procedures very conveniently. People come here from all over the world for this procedure. So when you ask about a definitive procedure, again, I would recommend a transconjunctival lower eyelid blepharoplasty performed under local anesthesia with light sedation. I recommend that you meet with qualified, experienced cosmetic surgeons, learn about their approach, learn about your options, look at some before and after pictures. It's very important to get a sense of what the surgeon's style is and what their approach is, and if there's any other supplementary or complementary procedures that would be of value. But I think more typically, I would just usually perform the lower eyelid blepharoplasty. Sometimes I would combine something like platelet-rich plasma, which is derived from your own blood and is a concentration of the growth factors for wound healing to help improve the outcome of the procedure in terms of healing, as well as to improve skin quality and texture. But that requires a physical exam and is a separate issue. So I hope that was helpful. I wish you the best of luck, and thank you for your question.